We're going to talk about tourniquets for the treatment of arterial bleeding. Obviously it's severe life-threatening bleeding. We're going to talk about tourniquets in general, but the one we're going to use is the soft T wide tourniquet. So some of the features of a normal tourniquet is it has a windlass to tighten the tourniquet. It'll have a wide band and it'll have a form of locking device, so the triangular locking ring on the soft T. The soft T tourniquet also has a clip so we can reroute it around a limb, whether that's a crush injury in a motor vehicle accident or a severely mangled limb from an explosion. When we apply tourniquets, they need to be at least 5 centimetres above the wound, so at least 1 hand space above the wound in general. If you're unsure on exactly where the wounds are, just go high on the limb so it's horizontal and nice and tight. So high, tight and horizontal if you're unsure of where the wound is. If you have a wound on the lower leg and that's the only wound, then just place it 5 centimetres above it, just ensuring it's not over a joint. It can be straight over clothing as long as there's nothing in the pockets. So I'm going to demonstrate on our trainer here how to apply a tourniquet to a amputation, severe amputation on the leg with an arterial bleed. I'm going to thread it straight over. I'm going to hold the windlass. I'm going to take as much slack as I can out and simply turn. And then lock the device, and we've done. Just check that we've stopped the bleeding, and then we'll do our normal packing and wrapping of the wound. So now I'm going to talk about placing a tourniquet on a limb by unclipping and rerouting. We do this for injuries where the limb is trapped, either a motor vehicle accident or industrial accident where machinery's caught the limb, or a really deformed limb, whether that's from a fracture or from a major blast injury that you see in IED injuries. To do it, we simply unclip, route it around the limb and then clip it back up. I'll now demonstrate rerouting the tourniquet. Unclip it, I'm going to thread it around the limb, reconnect the buckle, take all the slack out while the windlass. Again, just check the bleeding, and again, we just pack and wrap the wound as normal.